crawling woman, I could be an odious woman, I could be a contentious woman. But I'm gonna be a virtuous woman. 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 What kind of woman are you gonna be? God is gonna judge you. God is gonna judge you for the way you've been and how you treat your man. What kind of woman are you gonna be? God is gonna judge you. God is gonna judge you for the way you've been and how you treat your man. Virtuous woman, I'll be good to him all the days of my life. I'll wake up early, I'll be hardworking, I'll bring him food from far, I'll gird my loins with strength. Yeah. Say I'm gonna be a virtuous woman. I'm gonna be a virtuous woman. Ladies, I'm gonna be a virtuous woman. Alright, I'm gonna be a virtuous woman. Listen, I am gonna be a virtuous woman. I'll be strong, I'll be wise, I will look well to my house. I will not be lazy, oh no, I will not be idle. I'll dress in silk and purple. My husband is gonna pray.
Very wonderful and blissful good evening to you, our lovely viewers at home. It is indeed by the grace of God. That is why we see this very day, and then we are blessed to be on your screens this evening. We say that all glory and honor be unto the Most High God. Na sinini diina anka yene radi Yesu Christo. Se wadomi ye akwenye inso se enenyumre yembra wu screen subium. It is indeed by His grace. We give Him all the things. Would also like to use this opportunity to also bless our sponsors. First of all, the Mother Church Heaven Seekers Ministry. For such an opportunity as such, we would like to use this opportunity to bless our head pastor and our mommy, Pastor and Mrs. KURANCHIE. God bless them wherever they are, and may the Lord continue to increase the anointing upon their lives. God bless them so much, and God bless Abebio Dental Clinic. Abebio Dental Clinic, the confidence to smile. Just see Dr. Tilly Abebio, and she will grant you that confidence to be able to smile once again. And also, we are being sponsored by Jenako Fabrics. Jenako Fabrics, home of quality and beautiful fabrics. Just see them and they'll sort you out concerning any fabrics that you need for any occasion whatsoever. We are also being sponsored by Win-Win Driving School. Win-Win Driving School, where everybody is a winner. More better, no more license. Exactly. So it's a win-win fair. Yes, we are being sponsored by Win-Win Driving School, and we are also being sponsored by Modest Apparel Fashion. Modest Apparel Fashion, just as the name goes, anything modest, just see them and they will help you get whatever you want. We give glory to the Most High God once again for an opportunity as such. Today is a special edition, just as I said. Yes, our first one-on-one edition. And then one-on-one, if you just tuned in, this is the Virtuous Woman live on HSM TV, and we are live on Facebook on HSM TV Kumasi, Ghana. HSM TV Kumasi, Ghana. You can watch us live from there. You can send in your comments through the comment section. By the grace of God, we are going to read it out, and also you can send in your comments through our WhatsApp number 0205-168-739 0205-168-739. I'm sure our producer will have it on our screen very, very soon. Okay. So today I have a special guest in here. Yes, and we have a special guest. Hope we do in here. We need to derive all what we can get from him. Yes, the first man actually to be on the Virtuous Woman program. Yes, he's the first man to be here. Okay, so I have the person, in the person of Dr. Alexander Boye. Doctor, you are welcome.
Thank you very much, and it's really good to be here. To be also the first gentleman.
Oh, we thank God. We thank God, and also we are privileged to have you here. Yes, yeah, there are just a person, you know, as busy as you are. We thank God. We thank God so much. Please, would you like to say a word or two?
Yes, I would like to thank our daddy and mommy for the opportunity given us to be here, to be a blessing to many.
Yes.
And we want to also say a thank you to our viewers, cherished viewers who've been always watching us. Had it not been them, we wouldn't be doing this program.
Yes.
We pray they continue to watch, support us, so that they will continue to be a blessing.
Okay. Okay, God bless you so much. So God bless our lovely viewers. Continue to watch and support us, just as Doctor made us understand. Okay, so if you've been following us, where the America Kenya, we say yaka pregnancy they told us about the symptoms in each trimester, whatever goes on in each trimester. There a course will bani so yes, Dickness Constance in charge or my betre about that. Only so for Mammy Golda, Yeshra mu baby or be a nest of Mammy Emily, Yechia pa and then so we got to know about the symptoms the woman goes through and the stages that the baby also goes through. Today we would like to take a different dimension, but still within pregnancy. Last week, I think in pregnancy there could be some complications. More complication so but you say sometimes pregnancy and smooth and doctor would like to find out from you, what are some of the complications that can come up during pregnancy?
All right, thank you very much for the opportunity once again. But the complications that we could get during pregnancy,
yes,
just as you divided the symptoms in pregnancy into the various trimesters.
Yes.
The complications we can start complications that are associated with the first trimester.
Okay.
Complications that are associated with the third trimester, or better so we can say late pregnancy complications and early pregnancy complications.
Okay.
Yes. See, you can't early pregnancy complications now, right from the word go.
Okay.
And once I want you then I know my baby will be to me. I see. I want one, the kind. Mostly, a term where early complication it will be ectopic pregnancy.
Oh, okay.
Ectopic pregnancy.
Yes.
That is why when you're pregnant, you just don't have to stay home and you say over to feel baby. No relax to say onyam. The manyam no answer my me test straight na me dey check say manyam no dey manyam okay. It could be that you say now was onyam na kura and that would be anymore.
Wow. Wow.
So that's one of those earliest ones that you could get within the first 2-3 months no cry.
Okay.
That.
Doctor answer your bet was so the crowd. Sometimes a man and your dream said 9 months no. 87 may be a book once and I'm a hospital and now I may home to my mommy. Yeah.
That is actually the challenge and I said that you move baby.
Yes.
And say oh best start here corner brass I will be trying and sign our time as one but then most important thing is onyam no cry no I see who say nyinsa na da ba wodi no.
Wow.
Obi apart from say your ectopic no so obi ha wonyam so wonyam ba entimi am for me everybody those with abortions na every baby makes the abortion.
Oh, okay.
Makes the abortion no just say ono amoja bi entu ni say nyinsa na say by nyinsa you know sack no and I say moja tuan na da na wodi enu kwa but akuma bia na say nkwa bia enu na kire say course wanyini biem.
Oh wow.
So what they obi say wonyam and no be take you some time and say bia say unin say nim bia early pregnancy symptoms bia bia morning sickness fe hu ya ombre anyway no it will take some time then symptoms ni na article.
Oh, okay.
Once they are subsiding.
Yes.
Just with a mixed pregnancy because and hormones will start withdrawing.
Oh, okay.
And that one it could be there for some time. Hormones never withdraw to certain point. All of a sudden then moja start to say too.
Wow. Wow.
So that is one. And then we have abortions now, so you be a very incomplete abortion.
Yeah.
You bet me an incomplete abortion, and you say, bet me, I say, I need the mood and the I'm all right, but we bet a big canoe, a big car, the old one intino, Obeko bleedy, because this is a Obeko hospital. Yabemo or draw an answer, ya bear the friend DNC, no, you the can a free her. And you will be answer a complete abortion. And then you bet me a bath. I'm a model to help you, my bleeding clots and all that. I the amount of blood loss now. You bet me correlating it to the number of months and as a weeks when you know. Without even taking a scan, or doctor meet me like say amount of blood when I was working when you send I say there and then you send we I say and I say Nina by we.
Okay.
And you back be a friend or had diabetes from more. And I say your friend molar pregnancy.
Okay.
Molar pregnancy no. And no unyima a child dey na be kwa kobo awodi ene ho to be a source of nutrients and
yes.
Bibia amount and no etimi undergo some changes.
Okay.
And no you trust scanner okay in a certain the because we who be say honeycomb appearance. You see the honeycomb no?
Yes.
Or some grape-like vesicles, but to say grapes, no, I would no baby. And if you are outside there, or they could compare it to a snowstorm.
Okay.
That is what they use.
Ghana had you.
Yeah, so you compare it to the honeycomb. So, like, we always want to medicine. You always want to relate it to something that will always let you kind of understand and remember. So that one, based on your location.
Okay.
I say okay, grapes. Like I say. So that is how we can relate it to. I don't know. But I don't know one thing a woman say the pregnancy symptoms are always very much exaggerated.
Okay.
I don't know. The check your pregnancy now will be hormones be a woman my friend beta HCG.
Okay.
I don't know control pregnancy. I don't know. On the level on the bit me I'm one who say at this stage of the pregnancy, this is where the level is supposed to be. Okay. But you could just be like 2 months in your pregnancy and you check and you'll be like 4 or 5 months. The levels will be like 4 or 5 months.
Oh, okay.
So your pregnancy symptoms will be very much exaggerated. So you're vomiting,
Okay.
like you're advanced or probably or multiple pregnancies, no.
Yeah.
So or multiple pregnancies, and no, so pregnancy symptoms, yeah, so much exaggerated like that.
Okay.
So and then that one is a bit dangerous.
Oh, okay.
Compared all the mobile swimming any ectopic in the dangerous one, no? But the ectopic could be a silent killer, no dear. So that's a pyro yamna. Yeah, for one Drew Hospital in Tema, based on the amount of blood loss now, with the blood will not even come out. More than in PM Marbon. Ectopic, hardly will you see Sabia Una sporting, and I say, Moja is to so Kakanka, because Obeko washroom, no wipe, and I don't see a tissue, no, a Moja Sufi Kakra or so, and then all of a sudden you might start feeling some severe lower abdominal pain.
Yeah.
Either it is at the left side or at the right side. So we over now we are not now. One is here, one is here. And based on the tube, you know, the part that the sac or I say ectopic neuron, that is where we will experience the pain most.
Wow.
Then that of the reason why I'm also saying the molar pregnancy is dangerous. No, I don't know. Yes, it has the chance a bit more degenerate into what we call choriocarcinoma.
Doctor is taking us to medical school this evening.
It needs any bowel cancer.
Oh wow!
Wow, molar pregnancy. No? So we don't even say when you, if you are made free, the baby ma, be a baby man. I say, if you are very minimum telephone, and I said, you media. So it might be something else. And then, Oba Hospital, and no, the friend DNC in the mouth. We will have to clear everything from your uterus. We don't want to leave anything there. Wow. And then we even have to advise you again. You better answer to for say at least within a period of 1 year, you're not supposed to be pregnant. Follow any calendar scheme or schedules so that you don't get pregnant. We give you some form of family or birth control or protection. So that we are on them. The reason being that the beta HCG no, so the beta HCG no levels no, and then you be compare who say from and I say from. Only means the beta HCG level based on the gestational age no, a child then say
yes.
And yes. We wouldn't know whether I didn't a year free honor and then there's answer we care equal care.
Oh, okay.
And when you are getting the choriocarcinoma now, beta HCG level no, it goes high up.
Oh, okay.
And so for us to be able to properly monitor you well, you do lots of this serial beta HCG, no? Like you start here week.
You keep testing.
You do the testing for me at the first 1 month, maybe weekly, and we do it some level. Then then let's do it every month.
Oh, okay.
Then you do it up to 6 months.
Oh, okay.
It has gone to the level of the non-pregnant state.
Oh, okay.
So level just every hour. Beta HCG. You say, okay, I call the level of non-pregnant stage. Then they could your obstetrician or gynae might want to do it every 2 months or 3 months to the 1 year and the best man who say, and then it's about baby.
Okay.
So this one, the biggest warning is that people who don't want to follow up, especially where you know, I can say that only say baby and on by review. So those people, by the time they come, if it has degenerated into cancer, then it would have probably spread to areas and then to the level that you could do something, but then the outcome might not be good.
Wow. Wow.
So that is that with the first. These are just the first trimester. The first trimester. So the first 3 months. Let me say that one, and then when we come to the mid.
Doctor, please, even before we get to the mid, the molar is scaring me. The molar one that you spoke about. Is there something in particular, Chesabia, or banning you more year kofaba, and I say it has no cause. Wow.
It has some risk factors.
Okay.
It has some risk factors, but then it is beyond your control.
Oh, okay.
Risk factors, mostly the commonest risk factor, advanced maternal age.
Oh, okay.
You see, in obstetrics, they can't advance maternal age, and they can't age is more than 35.
Oh, okay.
So obstetrics, like you can't the ideal idea, and by 35 there, it is and we. No, as I be a small girl to say what. So, like, so when you cancer, and then somebody who has had a history before.
Oh, okay.
History is really important in medicine. If you have had it before, it means you stand at risk of having it again. It means those factors that led to the earlier one or your previous one could still be in play and cause and again. Basically, that one, these are the main things I hear with it. So it could be the risk factors of it.
Oh, okay. Oh, okay. Thank you so much,
You're
Doctor.
welcome.
Thank you. So now we'll be looking at then the second trimester. But then before we come to the second trimester, please let me take some few messages here. All right. So I'm taking some messages from Facebook. We are live on Facebook, HSM TV Kumasi Ghana, HSM TV Kumasi Ghana. You can send your comments through our Facebook page. Okay, so this is from our sister Elizabeth Ade. God bless all virtuous women. And the virtuous woman and virtuous man. God bless you so much. Baby, I will be I'm watching from the northern part of Cameroon. I love your TV programs. From our sister Sofa Nani Tasso. I hope I'm right. I hope I'm right. Please help us, okay, to understand what doctor is saying. Oh, I'm a new follower of HSM TV. My little worry is the prevalence language. The tree. I wish it was 100% English. Oh, our dear sister, we are trying our best to mix it. You know, we can't have it 100% English because some people here in Ghana also might not understand the English, so we are mixing it to help us all. So please, you just follow, you still get the understanding by the grace of God. And God bless you so much for following HSM TV. Please, the WhatsApp line, kindly don't call on the WhatsApp line, just send a WhatsApp message now. Once a month for Friday from Pacho. Only Dr. Boy to me, Cassava. And send a message at Faswa 0205168739. Your producer, Eddie Aguye screen is so Eddie Amaya, so you can just send a WhatsApp message. May the Lord help us. Okay, doctor. So then, with what doctor you are saying, that means, men kind of say, aside carefulness, should I say, we Christians, when we see that we are pregnant, we need to ensure, one, we do that routine follow-up, the routine ANC. We take it very serious. But then aside that, then we pray to the Most High God, because we don't have control over. So in as much as we should pray and also do the routine ANC. Every more ANC, no said they are pregnant, but then they want to relax. But please, in as much as you pray, you do the physical parts as well. Okay, doctor, now coming to the second trimester.
Even sorry, with the first one,
okay,
the first trimester or the early pregnancies now, there are a lot of things, a lot of diseases that might be associated with the mother that could lead to termination or abortion
of pregnancy.
Yes, of the pregnancy. Okay. Those ones, over in term, now it me identify disease. In our setting, even malaria UTI.
Okay, can abort the pregnancy.
Yes, depending on the severity. Early pregnancy is very variable. Within if you get any insult, it will be aborted.
Wow.
So over screening now, we do all those things. We do other tests, your HIV, syphilis, B, and all that. And all those other diseases that could even be transmitted from the mother to the baby.
Okay.
When we identify those ones, we could also give you medications and things to prevent the transmission to the baby. Okay. And also to prevent the loss of the pregnancy as well.
Okay.
So early report actually saves a lot.
Wow. Wow, wow. Early report saves a lot. Please don't say that your grandmom at home is telling you are pregnant and then you just stay at home, you do the urine test and that's all. You must be crying the urine test and yeah, beginning you're positive. Personally, one of my children, I did the urine test. I did it for like 5 times. They were all negative. I was like, okay, then I'm safe. But then I realized, no, I'm not okay. So the rest is history.
It could be false positives and false negatives as well.
Yes, please. So the best is to go to the hospital and have yourself checked, even when you start feeling the pregnancy symptoms. Yeah. So doctor, please, what about the second trimester?
Okay, so the second trimesters, the commonest that we have to deal with is the hypertensive diseases in pregnancy.
Okay. Okay.
That is mostly from the 20 weeks going. That's like I said, mid-second trimester going. From the 20 weeks going, in we are able to associate it with the pregnancy, because if you are less than 20 weeks, next time you're checking out OBP, we don't associate it with the pregnancy. So from 20 weeks onwards, we know that, okay, then it is the pregnancy hormones and the effect that is having on your body. That is what is contributing to that. So I don't know, your hypertensive disease in the pregnancy that we will talk about, preeclampsia, your severe hypertensive is in pregnancy, and then the most complicated of it all is the eclampsia.
Okay.
So the preeclampsia, your BP might go up so high with some features, like say you might have some proteins in your urine. When we check, that's when we do the lab. That's why anytime you come to the hospital, you want to check your urine to see whether or not you have proteins in it. Then your BP might go up or above 140/90 or even higher. And then you might have some symptoms based on the severity. We have preeclampsia with severe features. Let me just have a preeclampsia based on the severity. Some people might have some severe form of headaches. Severe headaches, you take your painkillers and it's not going away. Then some people will have blurred vision. Someone will wake up and then the face will be very puffy. As
a football box,
yes. We're sorry. Now come a bond tempems. Who cry into me in Susie. Obey say, you can't be gastric region and the boy no hano. When the or share there as a who be any as a oceana, direct gaze, that's on a near trial.
Wow.
So these things will tell you that the preeclampsia is actually set. This one is actually with severe features, and then check BP, the BP too will be high up compared to maybe I was starting ANC maybe say 8 weeks, 9 weeks. Ni booking BP and BP or the chassis and over checking on that. Across through Kessi baby abro and also. And then your baby will lapse and so on. Kind one multi-year why be one say you in no proteins soon. Who we are. Then this one we need to admit you.
Wow.
Then
Doctor Patrick, the women be so sometimes I don't pay you for no. Okay, labs, but not protein no. Who trace who most no monsieur baby is it true?
So in pregnancy, when we see proteins in your urine, that's why we just don't until you have one marker. That's why diagnosis.
Okay.
When you have UTI,
you
can have proteins in your urine.
Okay.
Until you check maybe I see proteins 2 classes BP, just like your booking BP, you don't have any other constitutional symptoms. Instead, your body also severe headache, dizziness, blood vision, palpitation, chest pain, epigastric pain, and all that. We need anemia. It could be that there is an infection, so you have to. Instead of just the dipstick number, and I said, we're doing some medical lab. Infection, infection, you may not treat here, it will go away. And the trace that they are talking about, early pregnancies, most people want to know so if you're interested. That's one I will see the baby in that could bear 2 liters milk. It's getting you dehydrated.
Yeah.
And so when you get dehydrated, the urine will be concentrated. And then those ones, you could have proteins in the urine. It might not necessarily be an infection or any temporary eclampsia, but because of the dehydration, so near Fiona, so it's me my way anything about.
Wow.
Trace and penny, they are actually right.
Okay.
It's good you keep yourself well hydrated.
God bless you so much for that, Doctor. If you just joined in, by the grace of God, this is the Virtuous Woman live on HSM TV. The Virtuous Woman live on HSM TV. And we are live on Facebook, HSM TV Kumasi Ghana. HSM TV Kumasi Ghana. You can send in your comments, just as I said, through our Facebook page. Which we are share watching our Facebook page and so HSM TV Kumasi Ghana. So now wait me so they are fire WhatsApp number and so 0205168739 and then you see Dian Kasanti say oh fear you can pen down something or you can type down something. Doctor, so the complications one can have during pregnancy. Pregnancy complications Rebecca is okay. Susan so bonnie a bit to me and pregnancy so abba. It's share Dr. Maya Tia Bebre first trimester, the sort of complications that could come discussed that I don't want to the second or the latter part of pregnancy, mid-pregnancy, near being so able to me cause that complications and our complications via a why you bet to me doctor eclampsia, pre-eclampsia, I say I have more and more common. They say yet seen more. And no, is it that a crown maybe a baby pushy mommy baby never be pinna question? And what exactly is going on?
You know, pregnancy actually puts lots of stress on the mother's body.
Okay.
The hormonal changes.
Yes.
And your body is supposed to adapt to the changes that are going on in you.
Okay.
And in so doing, you know, you can etiology of this pre-eclampsia, and we talk about some calcification in the placenta, villi, and all those things which will lead to that. And when you the volume of blood increases.
Okay.
Once the volume of blood is increasing, definitely the pressure through the vessels to increase and all that. But pregnancy is one of the hormones that sustains pregnancy. The progesterone is supposed to cause relaxation of your vessels to counter that effect.
Oh, okay.
But then God is wonderful actually. When you learn medicine, the physiology of things, you know that God is really indeed a good architect.
Wow. Yeah, of course.
Yeah. So all these are supposed to happen to counter all these kind of form of effects. But then your body might not be able to respond quickly to the changes that are going on in you.
Oh, okay.
It will happen. Apart from we having risk factors, again, those ones do have risk factors.
Okay.
People with family history of it, and again, people with multiple gestations.
Yeah.
Then you talk advanced maternal age, again, will come in here.
Okay.
And all that. People who are actually abusing drugs while they are pregnant, like smoking, drinking, and all forms of recreational drugs. All these things will be a risk factor of preeclampsia, eclampsia. And then when you're, I started mentioning some symptoms of the preeclampsia or features, severe features, the headaches, dizziness, palpitation, chest pain, blood vision, and all that. So, when you enter me and control, then it could lead to what we call the eclampsia.
Oh, okay. Wow.
The eclampsia is the seizures. You having seizures. Now, let me put in layman's a better say fit.
Okay.
Ucha.
Wow, that is serious.
Yes, because we be ecosra and you're controlled and answer complications from you, the BP going high.
Okay.
which this one do affect your end organs, your kidney, your liver, your heart, and your lungs.
Wow.
And more importantly, the brain. Because the brain, because you will fitness from the brain, some impulses will go on, and then you will fit naturally. And complications of that preeclampsia itself is a complication in pregnancy. And the preeclampsia on its own too has its own complications.
Wow.
Right. Complications that you have from the preeclampsia, it will lead to, or the higher BPs in pregnancy, it will lead to detachment of the placenta. From the baby? From the wall, yes.
Wow.
What we call the abruptio placenta.
Wow. That is serious.
Yes, if it is not controlled. So it's deadly. In fact, it's one of the leading causes of maternal death.
Wow. Wow.
At first it was hemorrhage, and as you see, emoji too. Because you see, we have blood banks in even smaller hospitals available. And then when you need blood, at least they could resuscitate you and transfer you to a bigger center. But if you have seizures at home, this will be new. Our Debaba hospital, where a baby pun last time I was telling Pastor Enoch that someone was rushing, I think, around 4 a.m. And when they brought the person in, the person was already gone.
Oh, together with the baby. Wow, this is sad. This is sad. The pregnancy
was quite advanced. The entire said, "Mom from the hospital, and she was around 36 weeks, and she had only attended 2 times antenatal care. First time I called her, when the book the first time I attended, her BP was high. I don't know whether they gave medication, but it wasn't documented in the book though that they gave medication. The second time I called, it was so sad. So they just rushed her in, even though she wasn't an attendant of our place though. But then you can see this is what happened. She will have several mouth and tongue bites to know that she suffered
a seizure.
Yes, several episodes of the seizure, and she was gone with the baby.
Wow.
So, this is what it is. And then if you don't even go with the baby, you could also suffer a stroke.
Wow, pregnancy.
Yes. So BP cause so being BP cause baby. So it means stroke.
Yeah.
One of the leading cause of stroke is hypertension, uncontrolled hypertension.
Yes.
It's the same thing. When you now BP cause I know so wait me and stroke. And you BP cause to the point so being fit now and I say seizures. It means it is that severe.
Wow.
And so you can have that. And when you have that, the blood flow, you can kill your baby. So when you can kill your baby. And if you don't come to the hospital early with you lose so much blood.
Wow.
That you might have to have several units of transfusion.
It's not easy to be a woman, doctor. Yeah. It's not easy to be a woman, actually. Hey, it's your it's just pregnancy. Oh, what is wrong with you? You are just pregnant. It's just pregnancy. Pregnancy is not just.
Pregnancy
it entails a lot.
Yes, just having another living being
growing in you. It's not easy. It's not easy.
It has a lot of things. It does to the mother.
And that means external stress beyond sign by mother. Because already she's going through a lot of stress, but then stress, emotional stress, and then physical stress or mother you are not helping.
Yes, those ones can lead to. So if some people who are pregnant, so that the preeclampsia, the other risk factors we talk of we talk extremity of ages, like extremity of ages, extreme of ages, like either those teenagers who get pregnant, they are at risk of it. Or those ages more than 35, they are at risk of it. Or they are that advanced maternal age. And then we talk of poor socioeconomic status. And all that. The things that you were supposed to be provided with as a woman to make you feel okay whilst you're pregnant, you might not get. And you might end up thinking about these things. And these are the people who don't attend the clinics. You understand? Like the emotional pressure we're talking about.
Yes, please.
Or doing say, if you nebana obe won no kra no, wonim de somehow the good nutrition. Benya abemani moja bibia koso kama. Do yes obeto na supplements ebeboa no ma why okay na wonde oyare omba hospital. So already she's weak. And if you add this stress to it, it predisposes the person from getting any of these complications that we're talking about.
Wow. Make I say, preparation towards pregnancy. So for my go that can say, bear man, what who say, oh, Pama, you're an man, I say, you're an start saving. Save your wife this kind of stress. I don't last time my daddy was advising someone, Nani Panere, it seems say I work and you're not feeling or be pesika or did the urine hospital. Whilst your wife has been pregnant for 9 months, 9 good months. 9 months, we yes every month be an amount so by the time 9 months never so that you don't put your wife through so much emotional stress and all.
So there are actually a lot of things that go on in the hospital that people will come and they actually require admission. Say any condition me and answer the ideal thing is one man treatment for some time and sign our coffee. The person will refuse admission. Yes, be admission now with the man no.
But the bottom.
Yes.
Yeah, some.
So you could see a group man and no one high. It's a no to know. The person will refuse. So the whole candidate. I think once you get ready and you want to father a child,
you
might
need to prepare your
as well.
yes.
Because there are a lot of things, the unforeseen things that could come with pregnancy.
Yes.
No matter to me, see. But all you say be over 5 father. This very one that could have abruptio, you need to probably have to go through emergency surgery. The baby, she might deliver preterm. Baby in neonatal intensive care and niku. On budget transfusions, several units of transfusions. She would have to receive special medications to get her better because of these conditions that she has. So at least we should say that we are only call one and answer what would be out 200 cedis. I think you should get ×5 of that put down.
Yes.
So do one say bibia nyame adom or fan no fan ba scanner wa wo dia.
Abesia be da wo bi. Yeah.
Utna ho ama de I didn't better.
Yes.
That's why we find ourselves wanting.
It's good to be overly prepared than to be underprepared. Doctor, we have some few messages here. I'll take some, but then we'll be coming to the 3rd trimester. Yes. Okay, so this one is from our sister Judith from OT region. All right, she's saying, please, good evening. I'm pregnant 4 months. Okay, so she said that she went in for scans twice and it gave her different EDD. Please, what is the cause of this and what should I do? As for the EDD, it will keep changing until, okay, so doctor will answer that for us. All right, this one is saying, please, good evening. God bless you for such a wonderful program and God bless our doctor too for this insight, Bra Joshua. God bless you so much, our brother Joshua. God bless you. All right, I'm Emmanuel. Watching live from Kumasi. Wow, good to see Dr. Boy. God bless you, host. We are really learning. A sister lost her child in the 2nd trimester last 2 months. She was in her 6th to 7th month and blood was oozing out. She was rushed to the hospital and they did CS, but the baby couldn't survive. Please, what could be the cause? Hey, the cause is here. Doctor has mentioned lots of things here.
They are not even done with them.
Oh yes, he's not even done with them. So the cause is it's a lot.
Yeah, but what he said, I could just guess and see what. Possibly. Like there are just 2 things that could lead to that.
Okay. So doctor will tell us the 2 things that could lead to that. All right, from our sister Priscilla Desse, and she says, please, God bless you all. God bless you to Sister Priscilla. All right, good evening, virtuous lady and gentlemen. Thank you so much for this insightful and educative program. God richly bless you. Please, I have Okay, discharges on my breast anytime I press it. And I have gone to the hospital for breast examination, but they say it's normal. And so I met a gynecologist, and he told me that I have hormonal imbalance. And my menses too is not normal. Even the first day of my period, the blood is just a small drop. Please, I need advice. I have never been pregnant before and have never given birth before. Okay, so this is our sister Hannah from Northern Region. She has never given birth before, but
just let me start with hers.
Okay.
Like if you press your breast and you're getting milk, and you have irregular menses and things, we have something we call polycystic ovarian syndrome.
Okay.
In short, we can call it PCOS.
PCOS. Okay. Okay.
So that one, there is high production of your prolactin. Okay. Prolactin is a hormone responsible for milk production, right? So when you are producing milk, you are not supposed to be menstruating. That's why we have some lactational amenorrhea. Okay. So all breastfeeding well,
yes, please.
So and then if you are not menstruating too, you are not ovulating.
Yes.
And you won't mean.
Okay.
Into this Oba hospital.
Okay.
Then the man drew.
Okay.
They check which of the hormones based on what. Then you the air course. You know what to do for her to get it.
Okay. Doctor, I'm going to because no say we na feel breastfeeding well na I feel you are not menstruating or feel then it's like should I say a family planning method, because you are breastfeeding well, you are not menstruating, you feel you are free. But now if you say sign of menstruation but ovulation Okay, so I have this message here. Okay, God bless you all so much for this insightful program. We hope to see more of Dr. Boye. More grace to you all in our Lord Jesus Christ's mighty name. Okay, and she say, oh, God bless you so much. God bless you so much. This is from Safumami Emily. All right, she's saying, please, in Jesus alone is life. Always happy to see my doctor on the screen and my host looking beautiful as always. God bless you all. God bless you too, Safumami Emily. Then, doctor, I think there was another question. Yes.
That one was about
okay, the first one is about the EDD.
Yeah, so the EDD changes. No, it's not something abnormal. Okay. Normally we use the first one you would take if you had gone to the hospital earlier, say within the first 3 months. Okay. When you look at the form, like the carbon sheet on your scan, you see something like some round thing there. That is what you could easily measure. That time, that is actually the baby. It's not moving anywhere.
Oh, okay.
So if you want to measure, you make a circumference around it. It is easier to measure and get the right thing. But then, when you get to your late second trimester going, the baby starts moving. So let's say, and we're using maybe the length of the femur. Okay. This leg from the knee to the thigh or the hip here. Okay. To measure the length of it or the circumference around her. See, I'm sitting here, I'm not even able to sit calm. I'm just moving all the time. Okay. So if you want to take the right diameter or dimension to use to measure, it wouldn't be accurate because the baby keeps moving. Yes. That is why your EDD will always change. Okay. But it is not wrong. But the best for dating that we use is the earlier scans that you took. Okay. So you shouldn't worry. It could change. If you take 10 times, it could change 10 times. 10 times. Yes.
So don't be worried at all. Don't be worried at all. Then the next one, the last question was about his sister who was rushed to the hospital and the baby couldn't
so that one, if it's not trauma, it's other two things. If it will be abruptio placenta, then we can abruptio placenta.
Yes.
Whether the placenta is detached from the uterine wall and you start bleeding profusely, or we have one other way that we talked about. The complications maybe abruptio placenta no and placenta previa. and the placenta will be at the lower uterine segment. But the quina is and baby in the first obano.
No, not
Placenta and I bet carry.
Wow.
And one so high, a friend of vasa previa. And then the placenta and Casaka see and Bobby our left side her. Not Kitwabi as a parasitic one be out and have a bone chain. But there will be vessels connecting this one and that one. And these vessels, it me, baby no prayer, or bit me at it.
Wow.
It's here leading proof.
Welcome you back once again to the Virtuous Woman live on HSM TV. The Virtuous Woman live on HSM TV. We are also live on Facebook, HSM TV Kumasi, Ghana. By the grace of God, today is actually a special edition. Makasa, any special. Wow, dear dancer, say you are indeed learning a lot wherever you find yourselves. And God bless you so much, wonderful viewers, for sticking with us and not moving away from your TV set even during the short time of break. So we, by the grace of God, we are here with Dr. Boye. By the grace of God, he's teaching us a lot today. Just as I said, you can also send in your WhatsApp messages through our WhatsApp line 0205-168-739, even as you can see on your TV screens. Okay, Doctor, I think say your answer questions now about honim nyina ye hwe EDD no hwe ni nuane de
17 weeks one.
Yes, there is another one with the main kind we answer near to us. I say I am a victim of the preparation in terms of the financial aspect. My first and second born was normal delivery, so I prepared for the normal delivery for the third born, but it turned out to be CS. I had to call for help. Thanks to some brethren who helped out. I owe them a lot. God bless them for what they did for me in my finances. But preparation, no. Obu, so maybe our first one, our second one, or third one, we the cocoa crab. Only for it to turn out to be a CS at the end. Didn't see preparation, yes, it's very, very necessary. Okay, and then now, yes, this message, the 17 weeks. I say I'm 17 weeks, and my scan says my placenta is in an anterior position, and my baby is complete breech. Please, can it change? My name is Patience from BOYE.
Yes, if the placenta is not, what I'm worried about now is even the placentation. And the anterior is not, even if it's not low, we are not worried about it. Even if it is low at this point, we are not worried about it because the uterus is not grown to its full size. It's just like you have a balloon and you use a color to mark some part. As you blow the air into the balloon, it keeps spreading up. As the uterus enlarges, the placenta will move up from the lower segment to the upper segment. And again, at 17 weeks, we don't even, when we scan you, ideally the person will not even tell you the presentation. So, at that time, the baby is playing football, that time, what you see there is not something you should be worried about. After 34 weeks, upwards, in the ultra scan, then your chances that it will change is kind of limited, but 17 weeks, they are people being in one.
17 weeks, they don't pay for being dinner under and sister patrol. Well, after their doctor can relax. 17 weeks is still too early. After a baby, no be moving more. Yes, please. All right, this one is saying, good evening. I'm learning and enjoying the show. God bless you and my doctor, Dr. Boye, from Dora McAfee. All right, God bless you so much, our dear sister Dora. Okay, please, Mommy, in Jesus alone, please, God bless you and Dr. Alexander Boye so much. Any pay. We are really learning a lot. I pray that more women will watch this wonderful program, The Virtuous Woman. God bless our daddy and our mommy for this wonderful program, and God bless all our mothers and all women. God bless you so much, our dear brother James Bonzi. God bless you so very much. So, doctor, now moving on. Yes, sir. And show more questions now. To us. So, yes, please. Moving on. Any other complications? Yes, then we'll go to the mode of delivery.
Yes. Then. Okay. Yeah. We have the preterm.
Okay.
Deliveries.
Yeah.
Preterm deliveries too are complications that we are likely to have.
Okay.
And then in pregnancy, some women too can have what we call DVT.
DVT.
Deep vein thrombosis.
Oh, okay. Yeah.
Deep vein thrombosis.
Okay.
That is, you know, we say pregnancy is a hypercoagulable state.
Okay.
Like in that I told you that when you're pregnant, the blood vessels, no, they move baby, and the pressure through the veins never kwaba, ebe move kwaba, ni nyina so, emanu slow, emoja ekobano. Akobani is slow kakra.
Yeah.
And in pregnancy, no, in order to prevent blood loss during labor, no, clotting factors, no, and as a normal boama umoja channel, and also costo.
Oh, okay.
Okay. Anything I say hypercoagulable state, the mechanism the tendency say blood clotting when you are pregnant is higher.
Okay.
And vessels means will be and it's kind of you have at the same word data. Now is stagnating air slow.
Yes,
the tendency say a bit me at that. Better vessel no
it's
high and emoja be at now block vessel and any friend deep vein thrombosis.
Wow.
The deep vein thrombosis itself no the includes through. But I say it's also a tendency say bit me up propagate and as be move free baby a one.
Okay.
Alcohol chest or your lung vessels no. Wow. That is the dangerous part. I know the alcohol my friend of that pulmonary embolism now. I know that it could if you don't get to the hospital on time.
Wow.
And then we have some complications that we will have in labor to refer to amniotic fluid embolism.
Okay.
So, but it's more common in say cesarean deliveries. Like in sooner or akrana.
Yes.
Some of them could enter the maternal vessels.
Oh, okay.
And it will, and also bet me across the same thing to say the DVT no course no.
Wow.
And then you could so
then doctor, but maybe so the deep vein is it possible that maybe when you are pregnant, or should I say in order to try to save yourself from it when you are pregnant, should women like exercise more? Exercise
is very necessary in pregnancy. I was coming to talk about that. Some things we could do to prevent
it
or minimize the risk of deep vein thrombosis.
Okay.
Yeah, exercise is part.
Okay.
And then as much as possible, these stockings. I don't know how to put it into more stockings now more air tight. No?
Yes, please. Yes, please.
My stockings now more but stretch now more air tight.
Okay.
It will be our that family history of DVT and I say what risk event so because when you man when you're a friend varicose veins.
Yes, yes. It's very common.
Intimate so you're not peja when now.
Yes.
So this area why I don't know it puts you at risk of the DVT. And not just a bit me at risk a bit me DVT.
Okay.
And we encourage that one ambulatory like obey exercise. Then yes, there be out to fact.
Okay.
Now just stretching and so it presses the vessels, not blood need me and move back.
Oh, okay.
And then medications go how it
me. Dr. Mincho, I know to say what do we call it? Hose. Very tight hose.
Oh, yes, so that will work.
Sleep.
That will work the same as your to say that no abo. Now it's compressing on those ones and it will help. It will work just like those. Your stockings sound for that.
Medical
your fermented stockings.
Okay.
You share all the time. And sound for almost and as time it may be almost 2 bit say aspirin. So anyway, so blood, to reduce the incidence of these DVTs and all that. And then post-delivery, especially those who deliver by C-section, your injections be or so you do more, it's a clexane, it reduces the incidence or the chances on this DVT you know. And then again, how when you know bit me banchaka watch it from already if anything so no are gaining more than
necessary.
Yes, so but we talk of the healthy average weight within pregnancy. Nangasa is like 12 kg. The averagely, if you gain 12 kg, it's healthy. But if you get more than
12 kg,
and then certain conditions to predispose you to these things that we're talking about. Again, the age, the maternal age, then the drug abuse, hypertensive disease in pregnancy, diabetes in pregnancy. I think that's also part of the complications that we mentioned. And that one too will come from the 20 weeks out of 10. All these things will come in. So all these things will predispose you and as they put you at a risk of getting these complications.
Yes. I realize even when you are pregnant, now we exercise, you feel stronger throughout your pregnancy.
Yes, that's very true.
Yes, I tried it, I think, for my second and my third. And by the grace of God, I realized the strength was more, than the first one even. Yes. Yes. So it's really helpful that we as women, we should practice, we should, exercise even when we are pregnant, not stressful.
Yeah, there are a lot of exercises these days. We are lucky to, or we are blessed with smartphones. When you just check on YouTube and check like pregnancy exercises and all those things. Some light skipping, some walking, and maybe some brisk walking and all that. All those cycling, all those things are good and to help.
Sometimes in the evening you can play music, then you walk up, down. It really
help.
Yes. Okay, doctor, I'm still having so many messages here. But doctor, then let's look at the mode of delivery. Very soon we'll be opening our phone lines too, so that our callers can call and check your baby in phone lines, not patrol what you mean afterwards. So now more and more questions, what you mean bisa. Okay, so let me take these messages. This one is saying that about 1.5 months now, I went through CS to have my child, but one after it, there was a health issue. There was a health issue. I went back and was told I had a temperate kidney problem, that it might have been during the pregnancy. Is this always a pregnancy complication? No. And see, when it's not common, it's not normal. I think they can look into it.
Yes, you should go to the hospital, then let them check it out. Probably she had other complications that might lead to that. Kidney failure has no direct relation with pregnancy.
Okay, please. Okay. So doctor has answered that you have to go to the hospital and then let them check up on that.
Especially before she gets pregnant again.
Okay, so before you get pregnant again, please let them check on that for you. Okay, wow, I'm having lots of messages. Okay, and this one is saying, you are all looking glorious, from our sister Gloria Opoku from Bokrom, South Africa. Ghana has South Africa. God bless you so much. This is from our sister Victoria, and she's saying, please, in Jesus alone, Soft Mommy, God bless you and Dr. Boy so much. Indeed, a lot is being learned and still learning through this program. God bless our daddy and mommy greatly. God bless HSM, our dear sister Victoria. God bless you too. Doctor, okay, this one says, I've not seen my wife for quite some months. She was having normal menstruation, but last month she had droplets of blood, which was not normal in the previous period. What should we do about this? Could there be an issue? Could this be an issue? So he has not seen his wife, had any personal behavior with his wife for quite some months, and she was having the normal menstruation, but last month she had droplets of blood instead of the normal
menses.
flow.
Okay.
Yes, please.
I think they have to go to the hospital and check.
Okay.
Probably, see, the menses, if you put it literally, it will be like the waste or waste blood in you that comes.
Okay.
Let me put it that way.
Yes.
But no, medically, that's not what it means. Just
okay.
for purpose of better understanding.
Okay.
And so, even when you are HB, you move on a level no performer. The amount of flow will reduce.
Okay.
And it's under hormonal influence. Menstruation is purely under hormonal influence. So if there's something that will change her hormonal level, the menses too will change. The flow will change as well.
Okay.
It could even be that she's just undergoing stress.
Oh, okay.
Her menses, or she's not this month. She's not eating well.
Oh, okay.
Like the previous month, she didn't eat well.
Okay.
So it won't come. So these are some of the things that could cause it.
Oh, okay. Okay, doctor. Hey, okay, please, I need doctor's number for medical education. Doctor is a busy man, if you need him, unless you go and look for him. Okay, blessed evening, virtuous woman and virtuous doctor. Pregnancies without complications are even not easy. How much more those that come with complications? God bless you for the education. Very needful, especially for those of you who have 6 more to go. Hey! Oh, Pastor Prince. Pastor Prince, this is what you're talking about, of Mommy Emilio. You're talking about your wife. She has 6 more to go. I'm almost done. More grease.
Get them a screw.
Yeah, we'll get them a screw. Exactly. Oh, more grease to your elbows. You look great in your very lady top, by the way. I was about to say this. Today, from up to down, by the grace of God, I was dressed by Berry Collections. Berry Collections. At the end, I'm going to put their number out so that you can call them. And even I'll be using their contact as my status on the same WhatsApp number so that you can pick it up and then contact them for all your office wear, ladies, gentlemen. They have them all. Okay, now, doctor, please, back to the issue of mode of delivery. Yes, what are the various modes of delivery we have?
We have the spontaneous vaginal delivery.
Okay.
That is like having the normal childbirth.
Okay.
We have assisted vaginal delivery.
Okay.
Those ones, some instrumentation might come in.
Okay.
And we have the cesarean delivery, or the one we call C-section.
Okay.
These are the various modes of delivery.
Okay. Okay.
That we have. And all of them might have, for somebody to do a cesarean section, there might be an indication for the C-section. Being it from the mother side, the baby side, or other complications that, or mother or baby, both, that could be assisted with the pregnancy. If you are having assisted vaginal delivery too, we have something that will happen that might let us have assisted vaginal delivery. And all these forms of deliveries to have their complications that are associated with them. So when you are choosing, then you have them in mind and you choose the one that you want. Having the complications.
Then, doctor, because of our time, we are going to do this. Our producer is going to put the phone numbers on the screen. Any befa 3 calls. Any befa 3 calls. And producer for numbers nigu and screen so MIA. But doctor, we'll do this when we take the assisted vaginal delivery. Then maybe you let us know maybe 2 things that could lead to the assisted one, and maybe 2 complications that could come out of it. Then we take the cesarean to 2 things that could lead to it, and 2 complications that could come out of it. Okay. While we wait for our callers. Yes.
Okay. So the spontaneous vaginal delivery is when you don't have, like, you come in labor, and then you'll be able to bear down on your own. While between me, be action.
Push.
That's why it's easy to ask you. But you need to be monitored, and then for you to be able to deliver.
We have a caller on the line. Hello, please, your name and where you're calling from.
Hello, my dear. My name is Glory Marie KURANCHIE.
Yes, mommy.
Yeah. Yes, the Lord bless you, and the Lord bless Dr. Boy very, very much.
Amen.
He's really, really a good and a wonderful doctor.
Amen.
That really I'm proud of. And Doctor, I say the Lord bless you so much.
Amen.
For the good work you are doing for humanity. Your time, your energy, and everything. I say the Lord bless you and give you long life.
Amen.
The Lord bless you and your family.
Amen.
And it is my prayer that you will never miss heaven.
Amen.
My advice is that the reggae song
Yes, Mom.
and giving way to gospel song.
Yes, Mom.
Doctor, I love you with the love of God.
Love you too. Well taken, Mommy. The advice well taken.
Bye-bye.
Bye, Mommy. God bless you so much. God bless you so much, Mommy. Okay, so while we wait for our second caller, Doctor, please, you can.
Yeah, so like the one that the spontaneous vaginal delivery, that one, when you are delivering, there might not be use of any instrumentations to assist. Like if we just support you to push and deliver your baby.
Yes.
Then we come to the assisted vaginal delivery.
Okay.
The assisted vaginal delivery, it might be that you are fully opened, but then you don't have the energy to push.
Okay. We have our second call on the line. Hello, please, your name and where you are calling from.
Yeah. Hello. Please, my name is Jane. I'm from KURANCHIE.
Okay, please.
God bless you so much for this program.
Amen.
It is very educative and we are learning a lot every day. But I have a question for Dr. Boy.
Okay.
Please, can I go on?
Please go on.
Please, I am pregnant and I'm 37 weeks, almost time for delivery. When I went to the hospital, they told me that my AB is low, 8.2. And then I would have to get blood transfusion.
Okay.
I was so worried. Why is it that they can't give me like Tosima or any blood tonic to help me boost my blood? And the second one too is, during my pregnancy, sometimes I become so quiet. I don't even want to talk to someone. I don't want to talk to anybody. And then my husband was always complaining. So I don't know, is it the same with me or is with every pregnancy? I want you to help me because my husband is so worried and angry at me.
Okay. Thank you too. Thank you so much, our dear sister Jane. So we'll pick our last caller very soon. Then after Dr. Boy will answer the questions.
All right.
Okay. So Doctor.
All right. So the one with assisted instrumental delivery, that one is also vaginal delivery. Okay. You have the vaginal delivery, all right, but then maybe after being full, you don't have the energy to push. The baby is there, so we need to quickly deliver the baby. We might use some instruments like forceps or vacuum. Hold the baby, grab the baby's head to pull the baby out.
Wow. Wow. We have our last caller on the line. Hello, please, your name and where you are calling from.
My name is Michelle.
Okay.
I'd like to find out if you had miscarriage and then maybe can we use the again, like can you get it after the miscarriage?
Okay. All right. I believe doctor will answer that for us. Can you get pregnant immediately after the miscarriage? Okay, so that was our last caller, actually. Right. Yes, doctor, please, you can go on.
So, thank you. Let me finish with the last, let me start with the last caller.
Okay, please.
Okay, so when you have a miscarriage, whether or not you could take a seed or get pregnant immediately depends on what led to the miscarriage. Okay. You know, when we're talking about the early complications in pregnancy, we talk about something like molar pregnancy. Yes, please. Now, and also a form of miscarriage. Okay. So, ectopic, maybe you underwent surgery before. So, you might want to wait for a while to be fully recovered from the surgery that we did before you could get pregnant again. Okay. For your own good. If it is something like, say, molar pregnancy, that we have to wait for a year before we get pregnant, fine. If not, if you just had a miscarriage that is not associated with any of these, then you could go ahead and get pregnant.
Okay. All right. Thank you so much, doctor. And
then the one who says she's 37 weeks, yeah. If you 37 weeks, we have hematinics there that we could give you. But at 37, mojedro the bema will be and sana mojedro from 8 now. Then cancer so complications no third trimester or labor complications no. Apart from the leading cause of maternal death, hypertensive disease in pregnancy is not a kind of and only hemorrhage. And I say a friend of postpartum hemorrhage. That is the leading cause of maternal death now. And to say, co-labor, which yes, labor, we can't predict what will happen. And most labors will come in the night. And I've been making of mommy palm. O negative. O negative. Blood now not common.
Yes.
So we want to prepare you. We want to put you in a good state before you go into labor. Because labor is imminent from 37 weeks now. Any moment from that time, I will be to me account. You need to me the line on mojedro. Say a man mojedro ama one say in Busu and Sana. Wow, Sana be higher. It's better we prevent the danger than to wait for the danger to come before we try to deal with it. And we see put you in a good state first. Now, Moja, see, I want Moja the end to know there. Okay. PPH, you can postpartum hemorrhage now. The moment you qualify see a postpartum hemorrhage, not just the amount of blood loss. So, a crabby drop a crown a better free Moja, so I don't know why unstable. Yet, I'm going to say a PPH.
Wow.
So already, when you good standing, we more than need a through that. Like a crabby free swap. That's a better shit. You don't know, guys, one could say, and we are phone or her. They be running up and down looking for blood everywhere. You tell you, as a woman, baby, or you're a cheese, just a referral higher center. Nadia, air course bleeding. No, and to me and see no coin, now for her. And anything I say. And some are over, no, you prepare in a good state, and some cry and a wow. So, when I say, more than I demand in our cry, like, see, we 8, you are stable. You're more based to 2, 3 come. No, do best at 11. Now, when I lose 3 in our cry, you will still be stable. So that's why there's a need to put you in the state before you deliver. Then she talked about.
She said she doesn't feel happy. I said, time beer, no, I ding. Her husband is complaining.
Yes, we have even in preparium, and as our movie, we are the baby preparium blues.
Oh, okay.
Normally,
sometimes your friend with baby blues, as in layman's perspective.
Like with a mother, they could get some psychosis or depression in pregnancy. Some people, what will lead to that, the fear, say, or especially first timers. Two, like this breastfeed that's all I know. Make sure we do never man a better than met me me meet me as or doing win some win now or doing financial capacity and capability and especially if they don't have any good support from home. So yeah, Nikunu cry when you Nikunu cry to cry one thing and can be Nikunu say one thing and can be some way can put them in that depressive mode. Even before they deliver, they could have depression. Anything like I say when they are pregnant, as much as possible, the men should be supportive. They should be there for them as much as possible. And when they give birth, to provide within their means.
Okay. And see, doctors say, back to your mode of delivery, where you can answer some questions. Back to your mode of delivery, you can't assisted, Yes. It's no, yes, and near my base, and I'm assisted.
Yeah, will be to say, forceps. Forceps, two different pieces. The back question, change the back. Okay, she are now lucky. It will be like circles na scissors na you need to try.
Yeah. Okay.
But this one is rather curved.
Okay.
But with me in a parts no too no.
Oh, okay.
Okay. So like it's molded in a way that let me have baby knitting no.
Oh, okay. Wow.
So yeah, na achieve baby knitting no. Na include the baby with it.
It's not easy.
And vacuum no.
Okay.
Vacuum no see it say a syringe and I said normal bent way yeah.
Okay.
I know it is sir. Okay. Also machine na create pressure. With the so baby knitting I know I create pressure no.
Okay.
The pressure will be in it like that. It will pull the baby alongside.
Oh, okay.
But it's not as easy as we are saying. If you don't have the techniques to do those instrumental deliveries, it's better if you have the means. You go and deliver by C-section than to try because it could lead to serious complications. Babies need to the baby and the mother. Obit me vacuum na making. Obit me the cost mother and service. Before instead so baby knitting. Obit me the cost different baby needs cap and kasa one na yadi. No ma pempe mo na yem reno na the person. Obit me ya the son na pempe mo obey and then the baby will get intracranial hemorrhage. And I say moja to me baby knitting. Now obit for top also mother and service to create pressure now it may take deep. And then uterus with the service when you are pregnant, within 1 minute, the amount of blood flow is like 650 to 750 mils per minute.
Wow.
That is why emoji 2 kuma ma wa woman.
Oh, okay.
The second you na abase emoji 2 if they are not able to resuscitate you well.
Okay.
How long will it take you to go?
Wow, a minute, 650 mils.
Yes.
Wow.
You can have that pregnant or uterus at 10 to have that amount of blood flowing through.
Oh,
okay. We have to do things to make it contract to minimize the blood loss.
Oh, okay.
Already, you make me my how. You put you in the good shape before you deliver.
Okay.
Okay. And then we know so sad the first steps necessary.
Yeah.
They can hurt the baby as well.
Yeah.
Or the same way, we also tears to the mother. Or it could enter go down a bit more do sabi rectum no. We don't know can damage blood in the process, the urinary bladder in the process. Or very no now when urine incontinence. And I will so a bar sabi want it. And I will join and I want it. So these are all some of the complications associated with it.
We are wrapping up soon by the grace of God. Doctor and Radinam Doctor Swatcher and my baby a mode of delivery no and you do the assisted vaginal delivery. Yes. Now what my baby I mean even the complications that could come with it. Is there anything a doctor Bepeso can answer your yes?
So now me can say so un dear say I mean me can in the terms of the medical caregiver no I will conduct delivery no.
Okay.
So when you the baby it's better you allow obi to me. Why? So when you operation or why it's better so very fair no. Wako baby to me and answer operation no more no. Because complications na the ban said na any and then it might take time. Operation corona where I said now can prevent no. The person might have to go through multiple surgeries to correct the damage caused by just the delivery instrumentation delivery no. That is just a take home for the caregivers now. And I said
okay.
And then you can see the mode of delivery. The next one is the surgical one no. Okay. Surgical one cesarean delivery. Okay. There were indications for her. And then maybe no and into so I bet me I said this year you operations and you banana. Okay. That now bano. Akra na ebe twa final scan no what the neto na eba.
Yeah, same.
Or the neto na eba because baby also. Now a headmaster said me need Obviously, the mother can't. If the pelvis have not been tried before, the mother can't push such a baby into. Or just you have to deliver by C-section. Why I know operation that no baby needs us. We don't want to put stress on the uterus. Why I know operation that now the intervals becomes very short. So by that might be the only source of entertainment. So because and our intervals need too short. We check the interval if it's less than 18 months, then definitely we might have to deliver you by elective C-section. And I make elective your emergencies or any electives or electives near the plan is and you care who no matter what and into young crema won't come France and those ones you'll be made aware just your operation some weeks or even months ahead of time, and time and also. We are operation pre-no. So if you undergo 2 cesarean sections, there will be a best of what can be an just yes, operation dada. We also presentation no, not be or enter for no, the would kind or the network never. I say, BM. Once I am a would dear Nan Casacrano, a how be a mother, Albecro, I would dear Nassino, not fibroid, and I say tumor can see this elbow. Maybe a baby neighbor farbano, fibroids no, when the baby knitting means anima. So I just a way operation. Honey, I know, I would dear no operation dada. If I say, why fibroid operation dada, the I would dear no baby dadanti. Now, who are they no conform? Until you can say, young man or contracted to the labor now, I would only bet me apart. Until we don't want those things to happen. Until you the normal elective, you're planning ahead, say, just a operation near you, Banamo. Then you have the emergency ones too. That will come. Emergency ones, no, so we will be on this eclampsia, you have to deliver the baby to save the baby. Be an abruptio placenta, Moja shall see it to know. So we deliver baby to save the baby. And in emergency, the do buy and I feel I am going to travel so from Ransan is a life and death. So we need to do the needful to save the situation. We go a child in Ancasano. I back at our would the end of quine and baby, yes, and baby by Fabano. Quite messy, you know, by father. Then those ones you have to be delivered by C-section. We are not operation you do carry in a balcony. Now, incision no more year while would you know? Yes, your vertical incision and your transverse incision. The healthy incision on the uterus no, is actually the transverse incision. But older. And as a senior, some of them, the easiest entry, maybe a comma vertical incision, and across the uterine muscles. You are very much at risk, you will rupture when you go into labor. So those ones you need to be delivered by C-section. Again, these are just few, and also when the complications. But then these complications that might come up, they are not significant. Maybe if you are having, say, 5 complications in 100,000, then you say it's really not significant to be worried about. When you come to the hospital and we tell you that that is what is necessary to save your baby, and I say, and then I hear my own brain, not my own for any got and since I saw Mr. Baby, and so I was only there with the check. I want to and so you can't but we should just concentrate on the positive side, and I think when you are in the right hands, things will go well for you by God's grace. Amen. Amen. Things will go well for you by God's grace. And then dear Chelsea, I ever stay Dr. Nkasa. You say once in a yellow moon, that be yellow moon cry there, come on.
once in a purple moon. We thank God for how far He has brought us. Indeed, Eradiadom Yesiani Amabibre, and then you remain so, and we are so grateful unto the Most High God. We say that may the Lord bless our sponsors, our daddy and our mommy, and the entire Heaven Seekers ministry. And you, our viewers, too, who took that your precious time to watch this program. We are so grateful unto you, and we say that may the Lord richly bless you, and may God bless our doctor so much, who took out his precious time. Doctor is a very busy man. Oh. He's very busy, but still he always takes out time to attend unto us, and then, you know, give us a portion of his time to educate us, even as he has done this evening. We say that may the Lord richly bless him so much. Okay, so this is how far the Lord has brought us. And the apaya time neho cry baby message is not the good trained doors, but then please, I'm promising you that God willing, next week I'm going to take all the messages you have brought in. There can be, I think, any questions. Most of them, no. Wow, kindly ask the doctor. It's important to me. Or the patron, there will be some question about how important it is to you. No, your phone, or there I will call you back. And I'll take the answer from doctor, and I'll call you back. If you have to go and see him, then you will go and see him. Okay, so this is how far the Lord has brought us. We are wrapping up. In fact, we are done for this evening by the grace of God. But then I would also like to take this chance to also bless my crew who never got tired. My camera woman, God bless her so much. Manager and the entire crew, God bless you all so much for your patience, your time, your efforts, and everything. We are so very grateful. God bless you. And God bless those who dressed me up, just as I said, Berry Collection. All right, let me quickly mention the number. Yes, the number. If you need anything from Berry Collection, I'll be posting their things on my status. Yes, the WhatsApp number status, so that you can call them and then place your order. Number, okay, I have one here. You let me give you that for today. 0558 712 484. 0558 712 484. Berry Collection, and they will sort you out. Whether you need it for a man or a female, they have it all, and they are all decent and good looking. They will help you and sort you out. All right. God bless everyone so very